demonstrating because they felt they had no access to food. You could replicate that demonstration in the transport sector, education, and more importantly in the health sector, where the cost of medication and services have shot over the roof. And beyond shooting over the roof, we have a situation where our best trained medical competencies are leaving the country in droves as soon as they find the best opportunity to live. And they are not replaceable, they are not goods on the shelf you can pick up and simply replace. It took so many years to train them. They have acquired experience and competence over so many years of practice. And to put it in a proper perspective is the fact that we always told that the educational system is not good enough, that it is training half-baked graduates. But what surprises me is that our doctors simply don't need any refresher courses. They simply go straight into the system and they compete and they are doing very well. So that means there is something special about medical education in Nigeria. It is at the cutting edge highest level. So that's what I am convinced, and that's what we did BSI. So the discussion today is that in the midst of all this crisis, how do we begin to see some little light, take steps? Because over the years, so much money has been spent in virtually all sectors, including education, including health. But at the end of the day, the health indicators are not moving forward. What I had almost 10 years ago about maternal and child mortality, what I had 10 years ago about a lot of things are still the same statistics. If they move, they will not move considerably for us to begin to celebrate. So what is wrong? Today's discussions will be more about solutions. So that's why we brought the representative of the Federal Ministry of Health, who is representing the Permanent Secretary, the Accounting Officer. That's why we have people from the National Health Insurance Authority. Because I always believe that to make the right to health, to let it become practical in the life of everybody, we must do sustainable domestic resource mobilization. And what do I mean by that? Federal government just put down 1.3 trillion for federal health services for the year 2024. By the time we go around the states, maybe put down all the money, it may not be up to that 1 trillion again. Or maybe let's say it means the federal government funding. So you're talking about 2.4, 2.6 trillion, which is really nothing compared to the needs of the country. And I know as a fact that by the time every Nigerian picks up a health insurance, you are going to have a brand new package of resources of not less than 5 million every year, and add it to what the government can do, and then you can begin to see bigger resources available to the health industry. So that's why we are here today. Of course, thankfully, the Basic Healthcare Provision Fund now has a website. You also need to hear them, say what advances they've made, and how properly funded and release the money that were supposed to come to them under the law has been. So that's the whole message that brings us here today. And as we are leaving the time evening, we'll be sending direct messages to the authorities to say, please can you consider A, B, C, D ideas for the improvement of health services in Nigeria. So on behalf of the Center for Social Justice and our partners in SCALE, are they represented here? Okay, you say SCALE. I want to welcome you to this very important, I wouldn't say August meeting because this is still February. This very important meeting.